Hi, I'm Dr. Steve Rosman, and today I want to talk with you about anxiety. Perhaps you, someone you know, someone you love, may be suffering from something that's been called anxiety or just feel anxious, and you've been looking for help. I want to tell you about someone who came to me for help about 10 years ago. Her name is Joan. Now, maybe her story is yours, maybe it's not yours, but I think when you listen to Joan's story, there'll be enough there so that you or someone you want to share this with will come out feeling hopeful and realizing that there is a person, there is a place to go where you can get help and you can get relief from. Because anxiety is one of those things you suffer with. It takes over every aspect of your life. Now, when Joan came to me, this was one of the people you would think would have the least chance of suffering with anxiety. And you know, there are many kinds, and we're not going to go into them right now. But there are many different labels we give to many different people who have these feelings that get checked off in a box, and then they're given the term anxiety. Because you know, anxiety isn't, we're going to get to this with Joan. You don't test for anxiety. It's not like going in for your cholesterol checkup and you're given a number and it says this. With anxiety, you meet with a professional who may be experienced, may be very learned and knowledgeable, but that professional has symptoms he or she has to check off according to a manual. And if enough symptoms are checked off, you wind up with that number and you wind up with that label. And if you don't, you fall between the cracks. But that doesn't change anything, because you're still anxious and it's still getting in the way of you living your very best life. Maybe getting in the way of you living any kind of life at all. So Joan came to see me after a relative of hers, actually a cousin who had been to see me for something similar, had said, you got to go see Dr. Steve Rosman. Now, before doing that, she went to her internist, who did nothing but prescribe an anti-anxiety or an antidepressant medication, because those are the things most often used. But he wasn't trained except for maybe the rotation he had in school. And so she didn't feel much better. She then went to see a psychiatrist, and the psychiatrist said, you have anxiety. Here's what you give your insurance. Here's your number. Here's your label. So she was no longer Joan. When she looked in the mirror, what she began to see, and this began the downward spiral, was she began to see a frown. And she began to see really sad eyes. And she began to feel in her body when she woke up in the morning, when she came home from work, when she was alone, even when she was in the midst of a crowd, she began to feel these feelings of numbness or tingling, or a feeling that blood was draining from her head, and she couldn't focus or concentrate. Her heart started to beat a little faster. She got a sick feeling in her stomach. And this is a person with a PhD who had gone through umpteen years of college and graduate school and did her doctoral dissertation and had to defend it in front of a whole group of people. And then went for interviews and got a job and taught English at a really well-known university and was beloved by her colleagues, was beloved by her students. At some point in life, she began to feel nervous, and nervous in a way she had never felt before. And she couldn't explain it. She couldn't talk to anyone else about it except to say she started to feel jittery or anxious, or certain settings made her feel off. She didn't have words for it. She could just speak her account, tell me what she was going through, tell others what she was going through. And so she was sent for certain tests. They checked to see if her heart was okay, because maybe she had a rapid heartbeat and something causing that. Maybe it was a hyperthyroid issue, and maybe that was causing it. And she went from doctor to doctor, each of whom gave her a medication. So someone slowed her heart rate, even though it didn't really need to be slowed. And someone gave her a hyperthyroid medication, even though it was barely hyperthyroid. And in truth, only one of the different thyroid hormones was measured, not all of them. So a doctor came to a quick conclusion, gave her a quick diagnosis, but it's never just that simple for a patient. No matter how quickly or how incompletely it was arrived at, this is someone who then believed she had this symptom. She was labeled, she was an anxiety sufferer. And so she took the pills for thyroid, and she took the pills for her heart. They didn't work. So what do you do next? If all you have in your toolbox is a hammer, everything better look like a nail. If all you have in your toolbox is a pill, you better find the right label for it. Because this is something, if it isn't thyroid and it isn't heart disease, and it's something that makes you feel anxious, after a while, the doctor you get bounced to, who's the doctor you get bounced to, who's the doctor you get bounced to, has no more tests. They've run out of tests. So they simply go down a list, check it off, and Joan got labeled. And after dealing with this for 3 or 4 years, and the medications that are involved are usually things called anti-anxiety medications. They're the Xanaxes of the world, or the Ativans, and maybe you've heard about these or your friends have told you about these. They're called benzodiazepines. Or maybe they're the Prozacs in the world, or the Selexes in the world, or other serotonin kind of modifying drugs. Or maybe they slow heart rate. And there are other kinds of medications that are beta blocker medications. Whatever the name, it's not important. But she was good. She wanted to feel better. It began to affect, this is what happened to Joan. She no longer enjoyed getting in front of her class and speaking and talking, which is something that had so fulfilled her life. It made her smile, it made her enjoy life. She got out of bed in the morning wanting to be with those students. But when you're feeling jittery, you're never focused on the people out there, are you? You're so focused on how you're feeling in here. So she felt disconnected from those who had mattered so much to her. In her own personal life, she got very used to being safe. And home felt safe. The couch felt safe. Sleeping in bed felt safe. Going back and forth to a store felt safe. So for years, she stopped going to parties. She stopped going out with friends. She stopped doing the things that she loved the most. And she chased one doctor after another after another. And she took one pill that didn't help. So she took another pill on top of that that didn't help. And another pill on top of that, it gave her a side effect for which they gave her a pill. And that didn't help. And so her cousin had remembered that she had come to me years ago with a similar kind of symptom. Maybe it ran in her family, maybe it didn't. And within a short period of time, 6 months, 9 months, we had gotten her all off of medication, and she had begun to resume the life that really made her happy, that really brought a smile to her face and brought a sense of fullness to her heart. So Joan came to meet with me reluctantly. What does a functional med doc do? What is that? After all, that's not a name we associate with doctors we're familiar with. It's not an endocrinologist. What the heck that means? That's hormones. I get that. A cardiologist, an internist, a psychiatrist. She went to psychology too. She had CBT, cognitive behavioral therapy, which helped her manage her symptoms, but nothing helped her brain heal. And anxiety always has something to do with the fact that we were made all those millions of years ago to recognize when that saber-toothed tiger came to that cave. We had 2 choices to survive, and survival is what we do best. what we have to run away from, or what we have to get aggressive and hostile about. If that's going to save us, that's what we're going to do. So you have this response, and it sets off all of these alarms in the body. And those alarms were made to make us either run as fast as we could to escape the saber-toothed tiger. Think about it as running away from a relationship, running away from a job, running away from parties and social situations, running away from things you used to love to do. Or hostility. I'm going to take a rock and hit that saber-toothed tiger over the head, which may not be the best idea. You get that close. You can sometimes lose an arm and a leg over that. But that's where anger comes out. That's where edginess comes out. That's where irritability comes out. That's where everything that isn't Joan came out. And people who knew her didn't recognize her much anymore. And she could feel herself losing relationships along the way because she was behaving in a way that her body was making her do. But she knew it wasn't heart and head and soul, it wasn't who she was. So she came to see me, and she learned that what functional medicine did was it dug beneath the surface. It said, Joan, you're not this DSM code, 5 code, saying you have this kind of anxiety. It's not this diagnosis number. It's not that you need to take this pill. What is it that's going on in your body? It's allowing that fight and flight response to take over and to change who you are. So we began digging, because that's what a functional med doctor does. I gathered all of her records from all those different doctors. None of them was going to look at all of it. I did. We spent time together. She wasn't used to spending that kind of time with a single doctor. After I did the research, I knew exactly what to test. And we did tests that most doctors don't do. Clinically relevant research tests. And we found out in her case that it was because certain chemicals in the brain weren't in balance. She had one that was overstimulating her, and that was making her feel anxious, and we had another that was supposed to pull in the reins and balance that one out that wasn't sufficient. So the one that was making her feel overstimulated, and the parts of the brain that were supposed to manage that and couldn't, we were able to give her natural substances that actually helped her brain make more of those. A pill isn't about, you do not have anxiety because you have a Xanax deficiency, but you may have anxiety because you have a serotonin precursor deficiency, whatever that means for now. Or you might have a magnesium deficiency or a B6 deficiency. In her case, we found out too that over time she had become sensitive to certain foods, and eating those foods enough made her overstimulated, made her brain depleted of certain substances that were necessary to anchor her. And then we were able to send her to a member of my team who did bio and neurofeedback. Simple brain-based kind of exercise that allows you to become empowered, to breathe, to get your life back again. And we did other things too. We found that she had a hyperthyroid also. But instead of managing it with medications, we managed it with targeted, researched, tested, professional grade, safe in the hands of a doctor supplements. Something natural, without the side effects of her prior hyperthyroidism medication. And you know what? Slowly, it didn't happen overnight. She had suffered with this for 20 years. But over the course of 6 months, we were able to get her off of medications. Over the course of another 6 months, we were able to balance her system. We were able to teach her how to slowly take back her social activities, all the things she loved about her life, one by one by one by one. And we did this in a way, in a partnership. I didn't do anything to her. We did a care plan together with each other. So whatever didn't feel right to her at the moment, if it wasn't primary, we were able to leave that to the side, and when we needed to, get to it. If I had a team member who was able to help her get through this, make it effective, practical, palatable, easy for her to do, we incorporated that. So as time went by, we slowly built it back and slowly built her life back. Within a little less than a year, Joan was only seeing me every 4 months. She was that much better. She had regained her life. She'd regained a beautiful smile. She was back teaching her students. Not that she ever stopped, but she was really there with them. She participated with them. She was back doing all of the normal day-to-day activities. She was no longer a prisoner of the bedroom, a prisoner of the house, a prisoner of trips back and forth to the grocery store. She was living and thriving in an optimal life at a level she had given up hope of ever regaining. To this day, she sends other people to me, but it's Joan I keep in touch with. It's been a couple of years now. I call her every now and then. And we speak. She's still doing great. And every 6 months, we do a checkup. And if anything's off, we tweak it. And if it's not, she moves along. Joan is an amazing person living an amazing life. And you or someone you love can be Joan. Be the next Joan. You don't have to suffer with anxiety anymore. Me and my team are ready here to help you, to get to the bottom of this, to help you reclaim your life, and to thrive. Dr. Steve Rosman, thank you.